We today sit at 1,063 COVID patients around our system. That is up from just a week ago. We were at 821, just to kind of give you a comparison. On July 1, we were at 62. So just to kind of give a comparison of just, really just 40 days ago. So significant increase. Currently have 14 pediatric patients across the system. I'll just give the numbers briefly. So 81 in Baton Rouge, 112 in the Bayou, 385 in New Orleans, 146 in Lafayette, 106 in North Louisiana, which includes Shreveport and Monroe, and 233 on the North Shore, which includes our partners St. Tammany and Slidell Memorial. So certainly we've seen an escalation as we anticipated, and we'll send you out more of those details on the numbers. The average age continues to sit right about age 55 for Surge 4. And, as we said, that's down from, what we saw in Surge 3, which was age 65, and in Surge 1, age 69. So definitely a significantly younger population. We have surpassed 500,000 vaccine doses that we've given across our system. We also have seen our vaccination rate for our employees rise to, for first doses, so they're not fully vaccinated, but first doses 68%. So just a few weeks ago, that was at 62%. So we're now up to 68% on first doses, and certainly happy about that process and that trend, and hopefully that continues in the future. I know we get asked about transfers a lot. In the past week, we've had to decline 175 transfer requests. Patients that are coming from other hospitals that are seeking a higher level of care that get transferred to organizations like Ochsner, that we could not take those transfers. So that certainly is impacting other patients, not just our COVID patients. The unvaccinated rate, continues to sit right around 90% of the patients we have in the hospital are unvaccinated. And we just haven't seen that deviate, substantially. So just running the math on it, it's actually 89%. So 946 of the 1,063 are unvaccinated. Just give you that number specifically. So those are some of the numbers. Testing has increased dramatically. We administered, for the week beginning August 8th, we administered about 15,800 COVID tests. Positivity rate is 19.6. And then 3,096 of these tests are in the age group 0 to 19, where we're seeing a 23.4% positivity rate. And I know, Robert, you were talking earlier about the significant change in the positivity rate of pediatric patients, previously versus in the Delta variant. So you may want to speak to that.
Yeah.
So anyway, I'll stop there. And Robert, Kathy, Sandy, those are kind of the high level numbers. We absolutely see this. We're at a critical time. You're hearing this from all the hospitals. This isn't just Ochsner. And it's really across all regions. It's New Orleans, it's North Shore, it's Baton Rouge, Lafayette, the Bayou, and North Louisiana. Basically, every place that we have hospitals, we are having huge issues in taking care of patients. We're having to push non-emergency surgeries off, so it is impacting other patients. We're having to close a lot of our outpatient areas like endoscopy labs and those types of services. So it is absolutely having an impact on thousands and thousands of patients who are not COVID related. And this is not an isolated thing. This is real. It escalates every day. And We just want to encourage people to continue to mask because that's one of the mitigation factors, and to get vaccinated with a vaccine that is absolutely safe and is proven to help people and keep them out of the hospital and to prevent them from dying. We did have last week 43 deaths across our system, so people are dying each week from this this virus, and it's a very serious situation. So Robert, I'll stop there, and Kathy and Sandy just stop there, see if there's others that want to jump into.
Just to give people the comparison to your comment, last week having the 43 deaths, go back 4 weeks prior to that, or maybe 5 weeks, we had 0. So that has escalated over the past month as well. And on the peds, Warner mentioned that on the pediatric front, we have seen a lot more with the Delta variant than what we were seeing among the peds group earlier. And that positivity rate has literally gone from around 4%, probably again 4 or 5 weeks ago, up to this almost 24% now positivity that we're seeing among children. And I think we have more in our hospitals, certainly the other hospitals in the state have more pediatric patients seemingly admitted now than what they had with any of the other previous surges. So I'll stop there.
And I know there's been a question, Robert, about ER volume, that sort of thing. We were definitely seeing our ER volume be up. You know, it depends on the region, but it could be anywhere from 50 to 70% increases, you know, depending upon the ER. So it's significantly increased, you know, in the past few weeks compared to what our normal ER volume would be. Same with urgent cares. Urgent cares are extremely busy. We know lots of time there's lines, folks waiting there when we go to open. So it is definitely a challenging situation. I don't know, Nicole, if you want us to just jump into questions, or Kathy or Sandy. I know, Sandy, you had this information. There was a question about, are we seeing more COVID positive pregnant patients? I know you had some of the data on that, where we are seeing definitely an escalation in COVID positive patients who are pregnant.
Yeah, and we're seeing them in both the outpatient and inpatient arenas. And currently we have 11 patients in our hospitals throughout the state, hospitalized pregnant women with COVID. None of them are fully vaccinated. So it's alarming.
Okay, I think I see we have received a lot of questions in advance. I can see a lot of questions coming through the chat. So I do think it's time we should probably just jump into questions. So let's start with the ones that were sent in advance. So Emily with the Courier and Daily Comment out of Houma has a few questions on treatment methods being used now for COVID patients. Have some of these differed over time during the different surges? And again, bringing up ventilators and how they're used currently for COVID treatment.
So the treatment has evolved since the first surge, but I would caution everyone that treatment is just supportive. We don't have curative medications for COVID illness, especially once somebody progresses and needs hospitalization. But for people that are in the outpatient settings who are at increased risk of COVID complications, we can give the antibody cocktails. The Regeneron product is currently what's being administered. It's an infusion, and it provides passive immunity and has been shown in studies to decrease hospitalizations and death. Once a patient comes to the hospital, we now know, and we've known since the early on first surges, that dexamethasone, a steroid medication, is helpful. And we also give remdesivir. And in people that have extremely high inflammation and are having difficulties with the respiratory ventilation, we can give them some immunomodulating drugs. But again, none of these are curative, and we have a lot of supportive treatments to give patients. And we still use ventilators in people that we can't give enough oxygen to by other means. We are judicious in our use of ventilators, but there are cases where we have to use the ventilators.
Thanks, Dr. Kimmerly. I know we received a question from BR Proud about COVID-19 psychosis cases because of the Delta variant, and if we're seeing any of these in our hospitals.
I would add, say something to that. We certainly see psychosis in patients who are in the hospital, certainly those in an ICU setting. I can't say, and we saw some clearly with all of the surges that we've had with the COVID-19. I can't say that I've seen more of this psychosis with the Delta variant than what we saw with any of the others at this point. Certainly something that we can watch for. We know that there are some neurologic complications can be with COVID, some of the lingering symptoms, but I've not seen that to be more of an issue with the Delta variant. And I don't know if my physician colleagues, Dr. Kimmerly, Dr. Baumgarten, if y'all have seen anything differently with that.
No, we haven't seen anything differently. Certainly when patients are ill and in the ICU and having difficulty oxygenating and are in a healthcare setting, sometimes that's pretty disconcerting to patients, and they can develop what we call an ICU psychosis, and also their mentation is just not as sharp as what it would be if they weren't ill or in the hospital. But no, we haven't seen anything different or above and beyond what we would see with any patient that had a similar illness.
Okay. Warner, we can, I think, jump into the chat with some of the questions.
Sure.
So we've got a question from Meg Ferris about a patient asking if a provider has been vaccinated and asking to see a provider's proof of the vaccine card.
I don't know if we've been asked about proof of vaccine. I don't know, Robert, why don't you take that?
Yeah, we haven't. I'm not aware that we've been asked about proof of vaccine. We've certainly had patients, and I think we'll see this more and more. Patients ask us, their care team, if they're vaccinated, who's vaccinated, who's not. And I think the question was that the question, or was it what do we do, or?
Explaining a patient's right to ask.
Oh, okay. Certainly a patient has a right to ask, and we are going to, we've committed that we're going to do everything that we can to accommodate a patient's wishes in those cases. But I will say, keep in mind, there are situations where we may not be able to meet that particular accommodation at either in a particular office, a particular specialty, a particular time of day, setting, that sort of thing. But I do think it's good to remind people here that all of our physicians, APPs, providers, and staff are wearing appropriate gear for the appropriate care setting as designated by the CDC. So we continue to follow those rules, but I think that's a good question. I think we'll see more and more patients asking about vaccination status.
Yeah, and then next Monday the 17th, we will, or actually on August 17th, we'll move to our new model of folks that are vaccinated will have kind of green badges, so that we know folks that are vaccinated. Others that are not will wear N95 masks. So that is a new process we'll move to. I believe that's on August 17th. Is that right, Robert?
Yes. Yeah, August 17th. And again, that's just another step. Again, as I think about the question, that's just another step in the direction of doing more and more to make sure we're taking the measures to protect our patients.
Yeah. I asked about staffing. We still are definitely severely impacted from a staffing perspective. We have about 500 and see, it's like 540 employees that are out that have tested positive for COVID. Now, once again, that's out of 33,000 employees across this state. So about 540 out of 33,000. But, that impacts, all of our abilities to take care of patients around the system. We have gotten some help through the state and through the federal government. We've gotten some resources that will be deployed to Shreveport next week. Some additional staffing will be deployed to Lafayette. And we're still working with the state to see if we can identify more staffing. But it's definitely a huge impact. We are redeploying lots of nurses out of our areas like our endoscopy labs and other areas like that in the outpatient area and deploying them into our inpatient units, deploying people from our clinics into our hospitals to assist in the hospitals, deploying out of the OR area into our inpatient areas. So we are deploying staff, but it's certainly a big challenge. There's no doubt about it. And I would just say that the team has been incredible. The teamwork has been amazing across our system, helping each of the regions, across hospitals, helping each other move patients where we have capacity. And then, folks that are just stepping up to take extra shifts, to redeploy to help in an inpatient unit. It's been phenomenal to see the teamwork across, all of Ochsner, our physicians that are going and essentially going to act as an intern, working with our critical care physicians, or go to be, essentially nursing support. People are just stepping up and doing what they need to do to take care of patients.
And I just want to add on to that, after Warner's comments there on the staff members that we've had out. We just spoke earlier about the safety measures that we're taking for our patients. That also, keep in mind, that helps keep our employees safe. And honestly, that's another reason to do this. We don't want to have any more employees going out on quarantine because of this. So these measures that we're taking to keep our patients safe, they will also help cut down on any spread among our employees, limit the number of people out on quarantine, and get those people back to work to help care for our patients.
And as a question about testing capacity, I think we've been, fine on testing capacity. We can do about 30,000 COVID tests a week. I said, we've done, 15,000, beginning of the week of August 8th. So I think we're fine from a testing capacity. The processing has taken a little bit longer than normal to get some of those test results, but I would say that process is working pretty well. There's been more waits in some of the urgent cares for testing. We understand that. I know we've stood up more of our drive-through testing and those capabilities, so we'll continue to monitor that carefully. So the 540 employees out who have tested positive or in quarantine. So the ones that are quarantined are folks who have also tested positive. So they've tested positive and they're in quarantine. That's the 540. What would trigger Ochsner to close its clinics down? We have actually reduced some clinic capacity already by redeploying staff and redeploying some physicians. I think a complete shutdown we'd have to see a significantly larger increase in patients. We have a lot of folks that work in our clinics. So we are hopeful we're not going to get to that place.
And part of that is matching skill set. We've been able to pull nurses from procedural areas who have experience doing other things, and CRNAs who have experience as ICU nurses, physicians who have ICU experience who we've been able to pull into different roles. So it would take a lot to just completely shut things down again. But again, we pull people as we need them and have them fill different roles for us. And that's the nice thing about our organization is people have been willing to step up and take on those roles.
As a question about the types of cases that we have not been able to accept transfers, it would be cases like GI bleeds, fractures, um, strokes, significant cardiac events. Those would be some of the things that we would see normally being transferred to us for a higher level of care. Sepsis, if somebody is septic in another hospital and they need additional higher level of care, they may be transferred to us. So those are some of the types of patients that we have not been able to take the transfers for in the past couple of weeks. I haven't heard anything about the VA hospital taking transfers. They have not, so I'm not aware of that. Robert, I don't know if you're aware of the VA taking other transfers.
I think the VA got some staffing, Warner, some additional staffing, and I know that they had taken some from some of the other facilities. I don't think we've had to utilize that just yet.
How about one for Kathy and Sandy? Can you explain the difference between the Lambda and the Delta variant? Here we go. I'm going to put we're going to go to infectious disease school here. Here we go.
Gonna take that one, Sandy? You want me to? So the Lambda variant, all of the variants are mutations of COVID virus. And so the Lambda variant is another type or strain of the COVID virus due to various mutations. So the mutations are a little bit different than the mutations that are in Delta. At this point, we haven't seen that in our region of Louisiana. There have been a few cases reported in the northern areas, and we continue to monitor it. It's a CDC variant of concern, so we'll continue to follow and see what happens with it. And it's one of those things we'll have to stay tuned. With Delta, we know that it was spreading quickly throughout the United States and throughout other countries prior to the United States. It doesn't seem like Lambda is doing that same sort of spread, but we'll continue to keep an eye on it. We'll continuing the sequencing, and we'll have a better idea of what's happening in the next weeks to months with it.
And there's a comment about the hurricane season and whatnot. We had several preparations for hurricanes last year when we were going through COVID last year. Obviously, we're in a surge now, so it would be a little more complicated. But certainly, we've got very detailed protocols around how we prepare for hurricanes, how we house people, the types of supplies we bring in, and that sort of thing. So we, if in fact this tropical storm comes this way, we'll be prepared like we are for I think it was 7 storms that came through our region last year. And so we have a team that's working on that all the time. That's in our disaster planning. And so if we need to trigger that based upon the path of the hurricane, then or the tropical storm, we would certainly, begin that plan and adjust accordingly. So, is Baton Rouge, Ochsner location out of beds, or is it still capacity? Robert, I don't know the specifics on. I think we had some capacity there, but I think it's depends on probably the moment and the day.
I was going to say that's really dependent on the time of day and at that particular moment. They've had capacity. We've helped them out at times with particular patients that needed to come here for something. But again, the nice thing about this is a good time to remind people that the length of stay for these patients is a little bit shorter than what we saw originally. If you go back to 2020, the length of stay for these patients is shorter. The age is younger, as Warner pointed out early on. And so some of these patients come in, stay a shorter time period and go home. So it opens up a bed. Now, again, right now we're in that point where there's other patients to fill that bed, but it just depends on the time of day and the situation.
Okay. I don't know if I missed any previously.
Warner, I saw one pop through about, is it possible to predict where we are in the surge?
Yeah. So we have models that are predicting our bed capacity. We watch this every day. We have seen we have what's called a symptom tracker and a COVID hotline that we get numbers to. We have seen those calls plateau a little bit, but I think it's not really possible at this point to predict where the peak is and where we are in the process of getting to that peak. Robert and Kathy and Sam, I know you've looked at the models that have come out of our research department. We still seem to be on the escalation and heading up the ramp. We don't see a plateau in folks coming to the hospital at this point.
Yeah, still significant escalations on the modeling, but to Warner's point, some of the things that we've looked at before that could indicate some advance notice of a change have shown a little bit of a plateau, but I think at this point I would hesitate to say it's any kind of a trend because we've seen this happen before and then have it ramp right back up. So I would love to say it was a trend, but I think right now it's way too early to say that.
I think we've covered a lot of the hot topics in the chat. So at this point, I will open it up. If you want to unmute and have a question or feel we haven't addressed something, you're welcome to do that at this point.
Hi, this is Destiny Patterson with KSLA in Shreveport. I have two questions. One of them is for the breakthrough cases. Have you seen a pattern between the dates of infection versus when they were vaccinated? And my second question is, do we know anything at this point about booster shots since we are seeing people who are vaccinated who are being hospitalized with COVID?
Yeah, so those are really good questions. So we are seeing many of our breakthrough cases who were vaccinated in the early part. So the first January, February, March. So that seems to be what's happening with patients. Regarding the boosters, we fully anticipate booster will be in our future. Now, when the FDA actually makes the recommendations that we can proceed with boosters, we're following that very closely, but it's still not allowed under the EUA guidance from FDA and CDC. But I think, and whether or not it becomes a specific group or a time period, that still remains to be seen. But clearly, boosters will likely be in our future for some of our patients.
Hi, Mr. Thomas, could you please address, there have been some complaints from residents in anesthesia and general surgery that they've had to take rotations in nurse tech rotations. Is that accurate? Where does that stand? And how would they make up their hours so it doesn't trigger a review of their residency program?
Yeah, Robert, I'll let you take that. Yeah.
Yeah. There were emails that sent out. We've got a lot of people helping out in a lot of different roles. We have attendings that are helping out in ICUs, on floors. I think there has been a lot of, from what I have seen, a lot of misinformation about what has been put out there. And we are in the process of gathering what we can from what's out on social media to see how this was put out there and in a way that really wasn't exactly how it was presented to our staff. And so we are tracking that down now.
But as far as I think impact to our training programs, I mean, I just,
Yeah,
not gonna have any impact to our training programs.
Yeah, no impact to our training programs at all. I will say that we've got people at every level of the organization helping out in places wherever they can. And that's been very much appreciated by nurse staff, by pharmacy people, by really everyone along the way. Our physician group to help care for these patients as the surge has grown across all of our system.
Question on how long will folks have to be deployed? Tell me how long the surge is going to last, and I'll tell you how long they got to be deployed. I don't know. So we're gonna have to keep people deployed until we get through the peak of this surge. If it keeps escalating, we'll probably have to redeploy more people. And look, just be honest. I mean, there's some people that we go to redeploy that don't want to get redeployed. Some turn it down, which is unfortunate. Many step up and want to do it. And so it really is an individual type of decision. But as Robert indicated, we've had physicians who are working in essentially nursing roles to support in ICUs. We've had, our, other areas in our clinics, our, medical assistants that have gone to work in the hospital to, help, be nursing aides. So it's really been all hands on deck to try to pull this together. And once again, this is an unfortunate situation. Nobody wants to be going through it. Some people get upset about redeployment. We understand that. But I would say that there's a very, very high majority of folks that are just in there doing what they got to do to take care of patients. And those are the folks that we see and talk to a lot. And once again, there's probably a few people that are not feeling that way. So.
This is Destiny Patterson again with KSLA. Do you guys have any data behind how many people have had severe negative effects to the vaccine, like heart issues, blood clots, things of that nature from the vaccine itself?
I don't have any of those hard numbers from our patients. There's data reported nationally on that sort of thing, but I don't have any data specifically on our patient population that we have vaccinated here at Ochsner. Dr. Kimberly or Dr. Baumgarten, do y'all have that?
We don't have data per se on that. We do submit any questionable reactions after vaccines, as we are asked to do and required to do through the VAERS and through the reporting system. So if there is a patient that has a concern about a side effect after the vaccine that's serious, we do report that. We don't have the data or the numbers as to what's happened with each and every case of reporting. And we don't determine whether or not necessarily it's vaccine related. A lot of these happen just by chance after the vaccine is given, but we still report it nonetheless.
We have other questions?
I think it's safe to say, though, Kathy and Sandy and Robert, that we've had a lot more people that have had complications from COVID than complications from vaccines. I mean, we just haven't seen it. I mean, there just has. I mean, I know there's been a lot of talk out there. I know there's been a lot of talk now about women who are pregnant, or folks that are women that want to get pregnant and worried about fertility issues. The OBGYN societies all recommend vaccination. And as Sandy indicated earlier, we are seeing more women who are pregnant testing positive for COVID and then being hospitalized. So, and in one case, dying. So, these are the realities of what we see out there and what's happening. So.
I have 3 quick questions, please. Has Ochsner applied for a DMAT team to come in to help alleviate staffing problems? Number two, could you give us a Terrebonne area update, please? And number three, what happens to the people who would have transferred and now can't, as far as their level of care? Thanks.
Yeah, Meg, thanks for the question. So on the Terrebonne update, I don't know if there's specifics that you want. I mean, as I said, in the Bayou, we have 112 patients between Chabert and Terrebonne General Medical Center. And, you know, we've continued to see escalation in cases in the Bayou region. It is definitely one of the hot spots. There's definitely very significant bed capacity challenges in that region. So that's certainly a concern, you know, down there. Remind me of your other two questions. I'm sorry.
Yeah, I'm sorry. I do that too. Number two was what happens to the people who would have transferred for the higher level of stroke care, et cetera, who can't? And the other one was, has Ochsner applied for a DMAT to help with staffing crunch?
Yeah. So we have been working with the state and making that application for you know, DMAT teams to get assistance. As I said, we got some EMTs, Robert, but I'm not sure those are really out of the DMAT or not. Do you know?
I think they came from a different pool, but we did get some paramedics to help us do some of the infusion work.
Yeah. So we have applied and we have gotten some staffing help that's going to Shreveport and going to Lafayette, and we've gotten some EMTs that have come here to help in the monoclonal antibodies, but I'm not exactly sure if they're DMAT or not. So I'm sorry about that. As far as the higher level of care, yeah, I think the facilities that are trying to transfer the patient, they probably would try to transfer them to another hospital, or they would try to care for that patient, you know, in the hospital that they're at. And just to be clear, we've had requests for transfers from Oklahoma, from Arkansas, as well as just, you know, patients kind of in our local region. So this bed capacity issue is not just a Louisiana issue. Texas is having issues, Mississippi's having issues, Alabama, and as I said, we've gotten calls from Oklahoma and Arkansas as well. So.
Thank you.
You're welcome. Other questions?
Right, yeah.
Okay.
Thanks so much.
Right.
Thank you. And I guess, Nicole, I'll wrap it up. If folks have more questions, you can get them to Nicole. And if these are helpful, we'll keep doing them. If they're not, let us know. And once again, we'll if there's more stuff to do sooner than a week, we'll do it. Otherwise, we'll talk to you in a week. So take care.